My name is Dr. Hillel Mazansky, and I specialize in medical hypnosis, guided imagery, nutrition, and exercise. My website is www.gianinc.com. Today's health tip is entitled, Does Your Sex Life Sizzle or Fizzle? Our sex is a very important aspect of a normal, healthy life. We do know that as people age, their sex desire tends to decrease, although that does not mean that they do not have sex. 45% of men over the age of 50 are able to have sex at least 2 or 3 times a week. Women, on the other hand, have sex less because they go through the menopause and they complain of vaginal dryness and decreased interest in sex, and sometimes they might even have pelvic pain. While this is well known about erectile dysfunction coming in age with aging, there are certain medications that can cause erectile dysfunction, not only in the older but in the younger person, and that is blood pressure medications, antihistaminics, and antidepressants. We also want to say something about the sex life of younger people. It is not only the elderly that suffer from sexual problems, but young men can also suffer these issues. Not so much of erectile dysfunction, but of premature ejaculation and difficulty sometimes in getting an erection. 99.9% of these cases are psychological. There is some issue in their psyche that causes these sexual aberrations. And they are helped and can be helped with certain techniques as well as hypnosis, which allows them to improve their sex life and have it more satisfying. Females do not use medication like males, such as the erectile dysfunction medication, because there aren't any. But to improve a female's sexual prowess, especially as she ages, we use the hormone called testosterone. Testosterone, although it is the male hormone, helps increase their libido. Postmenopausal females suffer from decreased sexual desire because their estrogen and progesterone decreases, and they complain of vaginal dryness. The other hand, men, even into their 80s and 90s, are still capable of having sex, although it's not as frequent as normal. The idea that one can get a heart attack while having sex is completely false. On the contrary, sex increases your immunity, improves your cardiovascular health, and decreases your blood pressure. So there's definitely no risk of having a heart attack. If you are young and you are married and you are having issues, it is our suggestion that you try a sex therapist first. These are highly qualified people who specialize in sex management. If that doesn't work, we have had excellent success with hypnosis, because during a hypnosis session we are able to penetrate the subconscious mind, and there are often issues in the subconscious mind which prevents them from having adequate sex. I thank you for listening to this health tip. My name is Dr. Hillel Mazansky.